So, hello, Aoife. Thanks for joining us today in this talk for Medics for Clean Air. Thanks for joining. I'm really happy to have your opinion, have you here. Aoife, would you like to just do a quick introduction about yourself and your background?
Sure, thanks so much for having me. My name is Aoife Kirk. I am a medical doctor by training. I'm currently working within the climate health space, which I've been really involved with over the last number of years. So my current role is Clean Air Lead at the World Economic Forum, where we're looking at how we can influence policy making around air pollution, as well as getting industries and companies on board on reporting and mitigating their air pollution emissions. Prior to that, I'm involved in, and still involved actually, in an amazing organisation, Cale, which I think you know as well. So it's called Irish Doctors for Environment. We're an advocacy group based in Ireland who have been really involved on looking at how healthcare affects environment and health, and also how the environment affects our health. So, as we know, with the current climate crisis, there's a lot of different effects that can happen, both to healthcare as an institution, but also to our individual and societal health.
Thank you for that. So yeah, you're the perfect person to be speaking to really about this, because the first question I wanted to put to you is, when we look from an environmental and health point of view, how does healthcare affect environment and health?
Yeah, so it's multifold in a way. So let me think about one of the best ways to frame this. I think, first of all, when we think about environment and health, we need to really go back to the basics of what is a healthy environment. And a lot of the diseases that we're now seeing in hospitals and healthcare systems are chronic diseases. So, non communicable diseases such as stroke, heart attack, and chronic diseases make up the bulk of health issues in the global north and also the global south at the moment. So, what a lot of those relate to is actually lifestyle factors. So, for some of this, we really need to go back to the basics of how do we promote good lifestyle and what effect does that have on healthcare. So, when we kind of move away from that as our basis and we start thinking about adding in these shock effects, such as climate change, we then need to start thinking about, well, are our hospitals functional enough as they currently stand for any shocks in the system? I guess COVID is everyone's kind of go-to at the moment, having recently had a pandemic. And we saw the difference within healthcare and hospitals around who could function, who was struggling with resources. And really, we need to prepare for these sort of shocks in the future, in particular as healthcare expands around environment. So we're kind of thinking as well around how does climate change affect infectious diseases with the spread of infectious diseases? How does it have an implication on migration, which is going to be a huge factor with regards to climate change, as well as conflict and scarcity of resources? And of course, other issues such as floods or heat waves. So, how do we really think about the vulnerable? So, for example, the elderly with regards to heat waves and other shocks, the children, pregnant women. So it's a huge spectrum when we think about environment and health, and we can go into different areas as you wish.
Thank you. So one thing I did want to kind of explore a bit more, because I know you've worked on it previously, is the effect of the healthcare system on the environment and on climate change, and kind of how, how the healthcare system can lead to this degradation of a healthy environment that you talked about.
Yeah, of course. So the healthcare system, as Healthcare Without Harm and the World Bank figures have shown, that if we have all of those healthcare systems put together in one place, it would be the fifth largest country as an emitter of greenhouse gas emissions. which is huge. So we're thinking about China, we're thinking about US, but actually healthcare itself is a huge factor of emissions of greenhouse gases. Um, so where do we look for? Well, the majority of these are in scope 3. So this is looking at our supply chain. And how does healthcare influence? Well, it has a huge influence on supply. So when we think about supply chain, we need to then think about pharmaceutical companies. We need to really think about plastic waste. We need to think about where are we getting our electricity from? Do we have a backup electricity? So there's a huge amount within how a healthcare system works and functions that we can start to look at. I guess going back to if you're a doctor or a nurse or a physio working in a hospital or in a primary care center, there are a lot of things that you can do, first of all, to look at your own area of scope. So one of the big things is plastic waste. So how can we reduce plastic waste, recycle, but also start to think about, are there any other alternative options? So a lot of this is getting people to think beyond, oh, this is our de facto option that we're taking. How do we maybe look at an alternative? One example from our group is around anesthetic gases. So desflurane is a huge greenhouse gas emitter, sorry. I think it lasts up to 104 years in the environment. And what our anesthetic gas group is doing is, even though there's not a significant difference between desflurane and other anesthetic gases, a lot of it is personal preference. So how do we shift that to other less carbon emitting gases? So there's a huge amount within hospitals that we can look at that has quite an effect on the environment and health. I guess waste is the other big one. So it's really important. It goes without saying that we have a proper infectious control waste and have proper waste disposal. But at the same time, a huge amount of waste gets and ends up being incinerated. So how do we make sure that a lot of this is thought about and thought carefully through before ending up in incineration or otherwise?
Yeah. Okay, great. Those are all really great points, and I really appreciate your viewpoints there. And I also really like how you touched on healthcare staff in their institutions. So I was just wondering, when we're talking about healthcare staff, do you see there's a role for healthcare staff to be advocates in sustainable systems and in climate change mitigation and adaptation in general?
So you're speaking to someone that is an advocate, so I'm slightly biased, but I would say yes. And the reasons why I also think we should be advocates is that this has such an impact on our own health, as well as the health of our children and future generations. Not only that, but health professionals are always advocates. So we would advocate against smoking, for example. So there's no reason why we shouldn't be influencing and advocating against fossil fuel use when there are alternatives. So in that respect, I think there is a huge role for health professionals to be advocating for this. We have seen huge movements throughout the UK, Canada, Europe, where medical professionals are beginning to realize the huge impacts that fossil fuels are having. I guess my area of interest at the moment is around air pollution, which has a significant effect on health. So with the rise of lung cancers, as well as heart attacks, as well as strokes, and it's also been linked to dementia. So in that respect, and also air pollution is actually the fourth biggest risk factor after obesity, nutrition. So it's a huge risk factor that we sometimes don't think about because it's quite invisible, but it is something that healthcare staff should be educated on and be advocating the promotion of alternatives or of renewables, for example. With regards to, I guess, it can be a very difficult concept to get your head around with climate change sometimes. However, when you break it down and look at concepts such as planetary health, so what effect has the health of humans have on the planet, as well as the planet's health have on humans, this is something that a lot of health professionals really resonate with and can relate to. And I do think that a lot of healthcare staff are quite passionate about environmental issues in their spare time. And one of the biggest ways that we will be able to change a lot of these policies and a lot of acting on climate change is through bringing our values through the workplace as well. So advocating for that in the workplace is something that I would strongly be promoting.
Perfect. Perfect. That's a really good call to action. Thank you, Aoife. And then finally, so you used to work in healthcare decarbonisation. So I'm just wondering, with your experience and with your knowledge, what kind of resources are you aware of that healthcare staff can use and access to be informed and to be trained on these issues? And what platforms do you know where people could get more information?
Sure. So I worked for an excellent organization called Geneva Sustainability Centre, who recently started out as being the go-to for informing and training healthcare professionals, in particular hospital managers, around these issues surrounding healthcare decarbonisation. One project that they have is called Carbon Emission Learning Lab, and that is an online virtual platform which looks at different levers that you can pull. So, for example, with healthcare decarbonisation, we're not just thinking about reducing fossil fuel use within the building or with energy. We have to go beyond that and really think about, where is our supply chain coming from? How do we manage our waste? How do we look at clinical practices? So how can we change to low carbon medications prescribing? How can we utilize some of those wonderful resources that are already out there? So that's one resource I would encourage people to check out, and they also have a great glossary for anyone who is new to the area. Another area or another resource I would say, which is very useful, is Healthcare Without Harm, and they often have great webinars. I know European Public Health Alliance also have some great stuff on this. And I think there are US-based centres as well. For example, Planetary Health Alliance has a lot of information. And the UK has done an awful lot of work already on decarbonising. So often the NHS have some great resources on, for example, their net zero plan. So they were one of the first countries in the world to announce their plan and their targets towards working towards a net zero healthcare system. So that would be another place that I would encourage people to go to become more informed. And I think they have a sustainability centre in, I think it might be Cambridge, that do a lot of courses as well for staff.
Yeah, great. Great. Thank you for that. That's a really extensive list. I appreciate you laying those out for us because, yeah, having worked in this field a lot, it's good to know, and, having your background, it's good to know where you would kind of turn to for information about this. Great. So thanks so much for that, Aoife. I really appreciate you joining us, and yeah, keep up all the great work. Thank you.
Thanks for having me, Cale. We'll chat
Great.
soon.
Yeah, all the best. Thanks.